Hi, my name is Amrita Paul. Today we are going to discuss risky practices of using social media in hospital and policies or guidelines to avoid these risks based on IT standard practices. In recent years, health practitioners have gotten more involved in social media for professional reasons and to facilitate connection with patients. As personal data is disclosed through social media, information management has become a critical aspect of the healthcare sector. The dangers of utilizing social media are growing day by day. To prevent hazards in any organizations, social media governance must be considered. An effective information structure will enable risk management by limiting employee using a social media. In this presentation, we are going to look over the most dangerous practices and offer guidelines or for procedures based on IT standard practices for dealing with them. The major risky practices we are going to discuss are first of all the privacy breach of patients in social media. Secondly, the medical advice that is taken through digital platform by the people and provided by different organizations. Third party involvement in hospital social media activities, spread fake news, unnecessary use of social media at workplace, negative comments, return on investment barriers, legal and regulatory barriers. First of all, we are going to discuss privacy breach of patients. Use of social media for medical records and data collecting has become excessive. A poll of 480 professionals, including media students, resident physicians, and practicing physicians, was done on patient privacy problems. According to the findings, 68% of them encountered ethical and privacy issues while transmitting patient information via social media. Violation of Health Insurance Portability Act is also a major risk practice. Health Insurance Portability Act is made for uh, suitably using the social media and internet for any healthcare purpose. Following patients on Facebook and sending friend requests is a major HIPAA violation. It expressively specified that for doctors to communicate with patients for any type of patient care, a HIPAA complaint permission signed by the patient is a must. As a result, it is strongly advised to avoid situations when direct social media interaction for patient care is required. Now we are going to discuss the unauthorized medical advice given through social media to the patients. Many health providers and practitioners address the risk in medical advice given through digital platforms. A survey conducted in 2009 provided that out of 61 percentage of people, 80 percentage of adults surf through internet to know about their health diagnosis. This resulted in risk of getting into wrong health information and medical advice. It was also found that increased use of people use with the more people posting medical advice in Facebook and Twitter has also increased the risk. As a result, there's chance you end up in incorrect health information and medical advice. It was also shown that it was as more individuals share medical advice on social media sites like Facebook and Twitter, other than other social networking sites. Next is the third party involvement in hospital social media activities. Uh, Through social and networking platforms, online fraudsters gain access to medical details. Online fraudsters have begun to deploy Trojans for remote access since physicians' contact has shifted to social media. Information thieves, keyloggers, and bankers are all in the loose. It was discovered that Facebook, Microsoft Outlook, Web Access, and Microsoft OneDrive were exploited to obtain patient credentials. The next main issue is the damage to professional image to the physicians as well as the hospital. One main difficulty of using social media, according to 93.3% of hospitals who participated in a research, is damage to professional image. The negative image established by social media cannot be changed and will persist in perpetuity. Once the news spread in social media networks, deleting any incorrect remarks appears to be a difficult task. Fake news is one of the most serious issues that social media has caused in the medical field, with the dissemination of the fake news that is shared without any permission. People believe bogus stories more than actual stories. According to a study based on 126,000 Twitter stories, where 1,000 people learned actual stories, top 1% of bogus stories readily spread through 1,000 to 100,000 people. Furthermore, misleading news spreads 6 times quicker than a real news. Unnecessary use of social media at workplace is another significant concern. According to report, physicians and workers at a government-run coronation hospital utilize their own mobile devices instead of performing their duty. Clients worry about the inadequate care delivery by caretakers because social media takes too much of their time. As a result, the hospital received unfavorable comments, resulting in a poor impression of the hospital, among others. Legal and regulatory barriers are the other barrier that can be addressed. Without a patient agreement, physicians and healthcare practitioners is not allowed to do any disclosure of the personal information or any medical condition of the patients. When permission is acquired, it should be noted properly in the post. Use a disclaimer to state that thoughts you have expressed is your own, not of your employer. If there is any doubt regarding whether or not material should be made public, the employee should seek clearance from the communication department. Health organizations should have rules in place regarding the use of social media for work and personal purposes. Data should be characterized, for example, so the workers know what the sensitive information is and how it will be utilized, and who can access and share the company material. Return to investment barrier is another major barrier. Using social technology is always helping the hospitals, but there are a lot of legal expenses involved in this, such as the time spent by the employees away from their other initiatives. Even though there are the customers believe that social media relationship the hospital have a significant impact on the hospital they use, the investment may not be always returned to the hospital. Now we are going to address the recommended guidelines and policies based on IT standard policies. Privacy and security are top consumer concerns while sharing their health information through social media. Healthcare providers should do the following using social media. Privacy settings must be done to protect the personal information and content. Develop policies to monitor companies' companies' presence in social media. Analyze content according to company standards before posting any sensitive content in a social media. IT practices to avoid privacy and security breaches also include maintaining professional content while using social media platforms, or doing any comments in a social media platform. Keep your personal and professional content separate, or create a different uh, account for a personal and professional uses. think about any consequences that is going to affect the patient or any privacy breach that can happen before you do any post in a social media or comment or tweeting in any social media platforms. Guidelines to follow to reduce spread of fake news are as follows. Content experts should see the activities that is occurring in social media. Journals are likely to turn to specialized social media consultants in the future to boost their influence. However, there will be always a need for a content expert to manage this operation, especially in specialized fields like hospital. A badly written tweet, a clumsy efforted comedy, or a misplaced selfie may all be a troublesome. Policy to follow medical advice given through social media mainly involves the usage of disclaimers while giving any medical advice or posting any medical treatment mechanism in social media. Disclaimers also assist in being protected by the law in the event that any issues develop from customers side when consuming or undergoing any therapy recommended by the provider. IG policies for creating uh, uh, avoid to create legal barriers include procurement requirements like doing the pre-contract inspection and contract legal provisions while working with or associating with other companies or providers. Contract performance management, which require resources and include a selected manager to audit. Security requirement include network security, device security including encryption, software security including protection against malware, data and system backup, secure transfer of data, and physical security. All these security and then data maintenance will help good information governance. Also, access control functionality, logging alerts, auditing, and reporting is also a good information governance practice. Other recommended guidelines include strike a balance between privacy legislation and expectations. Also, allow any employees to use social media without restriction. Restrictive IT regulations make it impossible for hospital staff to engage in any monitor work related interactions, as well as limiting the organization's capability to promote its culture. If you're thinking about using data intensive social media tools like movies or virtual worlds, be sure you facilitate the community to have bandwidth and download speeds to avoid any security breaches or any third party involvement. Uh, Other major guidelines also involves the maintaining of the patient community-centered mindset when aims and expectations are unclear. Privacy content may be used for wrong purpose and audience. Identify lawful commercial usage and put a stop to risk behaviors. Then, in writing, declare the organization's social media expectations and develop policy and standards for proper use. Educate and train employees in how to utilize the social media and company's policy. Reiterate the significance of exercising good discretion when utilizing social media platforms. In conclusion, we can be say that uh, despite the fact that there are many harmful activities in hospital setting, they can be handled with appropriate information governance, regulation, and standards. Also, while using social media for professional purposes such as Twitter, Facebook, it is critical to adhere to social standards. The next generation of mobile devices, as well as technical convergence, will allow more secure treatment of delivery between the patient and clinicians. So it is advisable to use social media in a good information governance manner. Thank you.